her appointment to update the paperwork the second time in 1 year so she can stay on ADAP and be put on a waiting list for dental care. These are just daily errands for her HIV care, not for her family. Meanwhile and foremost, she isn't a person infected with HIV, or just a person infected with HIV. She is a mother, a caregiver, a responsible member of our society who has the burden of society upon her. So we are waiting along with others across the country to be able to have HIV-positive women access community health centers, receive sexual and reproductive health services, have equity in the implementation of the HIV care and prevention strategy. We are waiting for the collective sigh of relief when we can cut infections in half and when we can see an end to HIV in sight. I ask how far we are willing to all go to make this happen.
Thank you. Just a reminder, we are sticking to the 3 minutes rule. Roberto Achuleta? Roberto Achuleta.
Yes.
Okay.
Good afternoon, distinguished party members, guests, and fellow colleagues. My name is Roberto Archuleta. HIV and AIDS have been living with me for the last 19 years. And I have been active in the HIV arena on various levels, which include a voting member of our local planning council, a voting member of our state CPG, and president of the Kansas City chapter of C2EAKC, or Campaign to End AIDS Kansas City. Today I have traveled all the way from Kansas City, Missouri to share my thoughts about housing as it relates to the implementation of the National HIV/AIDS Strategy. I also will mention how it has directly affected me, others from the community in which I live, and other persons living with HIV/AIDS or PLWHAs around this nation. In doing so, I will try my best to be as brief as possible. Housing proves itself over and over again to be a quote-unquote lifesaver for those living with HIV/AIDS. In my opinion, it is safe to say that housing plays a very important role in one's support system, and not only has served as a form of protection from the weather and ailments found outdoors, but it has also provided me with a huge sense of safety, a place for the proper storage of meds, accessibility to temperature or climate control, a comfort zone where other PLWHAs can meet for those grassroots brainstorming sessions without interference from the outside powers that be. Housing also provides me with a place to lay my head for a good night's sleep, or for those times during the day when I find that a nap is necessary. Whatever the form of support that housing may offer to either myself or other PLWHAs, the most important aspect is that it greatly helps to reduce stress, which in turn allows for a healthier and prolonged life for a person living with HIV/AIDS. I was very pleased to hear the creation of our nation's first HIV/AIDS strategy. I give sincere thanks and deliver the same for many. There are, however, a few areas of concern. One is found on page 17 of the implementation plan, bullet number 3. Increasing the percentage of Ryan White recipients with permanent housing from 82% to only 86% is unacceptable. Please consider to aim higher when asking others to help reach this goal. By doing so, helps to build the faith in your vision of the strategy, and you also are helping to gain specifically the buy-in from other PLWH in the community. The other is on page 21. The question that comes to my mind is, if an outline to address policies that are to promote access to housing and supportive services for people living with HIV, and please include those living with the AIDS diagnosis, and if these services are recognized as critical elements of an effective HIV care system per your implementation plan, then why is the waiting to be implemented until the end of 2011? Why not sooner? Also, with the same rationale being kept in mind as mentioned prior, when looking on page 24 of section 2.3, why isn't housing included in the promotion of a more holistic approach to health? I thought that a goal as described in the implementation plan for the housing service category is supposed to be considered a critical component in an effective HIV care system, less than encourage state and localities to make changes towards meeting this and other goals as set forth in the plan, but start demanding or mandating that appropriate changes be made in order to start holding these entities accountable when looking at realistically meeting such goals.
Okay, thank you very much, sir.
Thank you.
Our next speaker is Tony Ray.
Good afternoon, ladies and gentlemen. I'm Tony Ray, co-chair of the Youth Action Institute under the Campaign to End AIDS. I'm HIV positive and I'm 24 years old from the state of New York. As the HIV/AIDS pandemic approaches its 13th year, these successes give us much to celebrate, but much work is to be done. With more than 5,600 new infections in the United States each year, we must do more as a nation to stop the spread of HIV infection. President Obama is committed to refocusing public attention on the domestic HIV/AIDS epidemic. At the same time, the administration is committed on our ongoing efforts to ameliorate the global pandemic. The aforementioned statement was published with the White House Office National AIDS Policy to embark upon the establishment of a national HIV/AIDS strategy for 2010 to 2015. The statement below is made after careful consideration of the NHAS in its attempts to outline a way forward with the impact of the NHAS on youth within the strata of HIV/AIDS eradication. Further to the Campaign to End AIDS, C2EA, Youth Action Institute, July 2010 Shreveport Declaration, and June 2010 statement, the President's Advisory Council, PACHA, which outlaid a 2-year action plan for youth advocacy and prevention and eradication of the virus. C2A Youth Caucus, appointed by the committee membership input, analyzed and compared the working documents of the national strategy. While the NHAS describes the establishment of healthcare benefits in the context of new healthcare reform bill, the Affordable Care Act, it does not clearly state any youth-specific programs or addresses the challenges that youth may face in relation to health benefits. ADAP waiting lists are were mentioned once in the entire strategy, while further formation of management were not mentioned at all. While the document has called for education programs in schools, no clear implementation of this is suggested, and no acknowledgement was made while the school outreach is necessary. Alone, it will not be enough to reach all at-risk youth. Additionally, minimum national standards must be created and most importantly enforced to ensure minimum of scientific evidence-based models for educational programs in schools. While the topic of science-based sexual health education was mentioned, not enough emphasis was placed on youth methods to get this information palatable within reach to them. The strategy needs to acknowledge that more dialogue must take place among persons living with AIDS and allow for venues that can facilitate this. While Puerto Rico and the U.S. Virgin Islands were mentioned in the strategy, more attention needs to be placed on all U.S. territories. Community-wide social marketing plans and campaigns are a great way to reach youth, but youth representation must be incorporated in the planning, implementation, and evaluation of such programs. It is clear that much effort has been given to creation of said strategy, but it is more than abundantly clear that the strategy itself is weak and neglects to specifically address one or more high-risk proportions of society, youth. This oversight is unacceptable and is particularly unnerving. Considering that the authors of the strategy mentioned the disproportionate effect of HIV among youth, the statement only outlines discrepancies on a very small scale. There must be larger input from youth to the discussion and policymakers, and there is a definite lack of communication which resulted in this lack of representation. The most prudent remedy would be for the White House Office of National AIDS Policy to open massive lines of communication and make clearer and more specific action plans, lest the strategy be a token of the tribute to the fight of HIV/AIDS, as opposed to a vital turning point in the ending of the epidemic in our great nation. Thank you.
Thank you. Susan Miller, please.
Good afternoon. My name is Suzanne Miller of the National Coalition of STD Directors, which represents STD program directors in health departments across the nation. For more than 20 years, CDC's Division of Adolescent and School Health has worked with schools across the nation to build the necessary infrastructure to provide a coordinated approach to school health education. And a significant amount, $40 million, of DASH's work involves funding state, and local education agencies to closely collaborate with health departments to deliver effective STD and HIV prevention programs. The Senate Appropriations Committee has passed our FY11 Labor HHS Appropriations Bill, and it effectively eliminates DASH's funding. NCSD, along with many organizations in the HIV/AIDS and adolescent health community, are strongly urging Congress to maintain DASH's current funding structure. We also request that the Subcommittee on HIV Incidents immediately draft a letter on behalf of PACHA to members of the House and Senate Labor HHS subcommittees, expressing their support to keep DASH funded and operational. NCSD would also like to comment on the recent CDC study finding that 1 in 5 men who have sex with men in 21 U.S. cities is HIV positive, and to underscore the important role that undiagnosed STDs, particularly syphilis and gonorrhea, have in contributing to such high HIV rates among this population. Earlier this year, CDC released data indicating that rates of syphilis are more than 46 times higher among MSM than heterosexual men. This finding prompted NCSD and NASDAD to release a joint statement of urgency on the need to dramatically scale up efforts to prevent HIV and STDs among MSM. NCSD urges PACHA to ensure that increased attention to STDs are meaningfully integrated into implementation of the national strategy, and we specifically request, this is my other ask of PACHA, that PACHA specifically asks CDC to provide recommendations for addressing STD and HIV co-infection issues and for their implementation plans for the national strategy. Thank you.